Okay, so we'll just give chance to the audience
to
join. Okay, so everybody can switch off their cameras, mute yourself. We wait for the audience to join, so we'll start as soon as we have at least even 20 in the audience. Good day, everybody, and welcome to this webinar, which is being hosted by CWIS, Eastern and Southern Africa Water and Sanitation Regulators Association. The webinar is on citywide inclusive urban sanitation regulation framework in practice. My name is Yvonne Magawa from CWIS, and I will be joined by a great panel and speakers today. My co-host is Kasenga Hara from Executive Secretary of CWIS. So in beginning today's webinar and looking at the issues of citywide inclusive urban sanitation, we are here to really discuss how regulation can work in practice when we talk of inclusive urban sanitation. Next. So before we begin the discussion, I'll just give a very brief outline of basically a background to the discussion in terms of the status of the sanitation sector, as well as what the CWIS regulation framework is that we have recommended from CWIS. Next. So, as most people know, globally, it's been estimated that between 2.1 and 2.6 billion people in low and middle income countries rely on on-site technologies. Looking at our own figures from the Eastern and Southern African region, indeed, sanitation coverage by sewer network is estimated at less than 15% of the urban population, which means at least more than 80% of the urban population is relying on non-sewered methods. Traditionally, the sanitation sector is not much different to how the water supply sector began. It still has, for the most part, a fragmented institutional setup. We do not have a particular responsible entity that can be held accountable for service provision. And we find a multiplicity of actors. There are all sorts of actors within the sector. And where does the buck stop? There is actually no coordination. You find this one is doing something in this area, another person is doing the same thing in the same location. Too many actors, no particular person to hold accountable. There's also a lot of illegal dumping because of lack of enforcement, which is leading to high pollution, especially for underground water. Prices are largely unregulated and driven by the market. And you find that in most cases, it is the poor that suffer because they cannot afford that service. And in terms of service delivery itself, really, can we say that there is service delivery? Because there are no standards even for the quality of the service delivery. So what recourse does a consumer have? So there is an absence of a consumer voice who may not even know what to demand and who to demand it from because of what I have mentioned about too many actors and the fragmentation of the sector. At the end of the day, what we see is that there's also a lack of investment. The existing infrastructure, which tends to be sewered, is very limited and serves only a few. The question now is, who looks after the interest of the majority? Drawing from this background, CWIS has been working on a harmonized regional approach next to be able now to have an intervention in the sanitation sector. Next. So CWIS has developed this recommended framework for the sector in terms of inclusive sanitation. This means looking at both sewered and non-sewered sanitation services. So the recommended framework looks at the policy, regulation, and service provision. Who are the responsible institutions? How is accountability being handled? So on the policy level, 4 ministries have been identified as having an input into sanitation. But the main ministry would be the ministry responsible for water and sanitation, or in some cases, sewerage, which would be the ministry that would then formulate policy for water supply and sanitation. The other ministries which would contribute to the sanitation policy is the Ministry for Public Health, Ministry responsible for environment, as well as the Ministry responsible for local government. At the regulation level, there should be a single entity that is then translating policy and translating the legal provisions into what service provision should look like. So these are rules, regulations, bringing sanity to the sector. So a water supply and sanitation regulator has been identified. And to say that this regulator is then responsible for issuing an operating license for fecal sludge emptying and transportation, as well as for centralized and decentralized units. What an operating license does is then it requires somebody to operate in a given area and at the end of the day, be held accountable for the kind of service that they're delivering in that particular area. So to assist on the regulation side, the other agencies that have been identified are the Water Resources Agency, which deals with monitoring of effluent discharge quality into the raw water sources. The Environmental Agency, which looks at fecal sludge and effluent quality standards. Then also the local government itself, the municipalities who enforce standards for the sanitation facilities. And they would also be coordinating in the preparation and monitoring of the implementation of CWIS plans. So the regulator then licenses a utility to be able to provide service in a given area. That utility then on the service provision side can then delegate the functions to the private sector. In other words, what we're saying, there should be a single entity that is accountable for service delivery. Under that entity, there can be delegated functions to the private sector, to community-based organizations. But that single entity is the one that will report back to the regulator in terms of how service is being delivered. So the utility delegates the functions for, say, treatment, facilities for decentralized units. It can also delegate the functions for emptying or transporting through a permitting or contracting method. So if you see in terms of accountability, then whatever is delegated out to the private sector or community-based organizations, those are then accountable to the institution that has given them the mandate to operate in the service area, which is the utility. The utility is then accountable to the regulator. The regulator is accountable at a policy level as well as to the consumers. This is the recommended framework that CWIS came with, has in terms of a harmonized regional approach. Next. The recommended framework also stipulates the roles and responsibilities across the full sanitation chain. So from capture all the way up to disposal and reuse. What is policy responsible for? The institution at policy level. Where do they cater? You can see it is across the whole chain. The regulators, where do they come in? So each and every entity that has been identified as having a role to play in sanitation service delivery has also been identified in terms of where they play a role in the different segments of the chain. So you can find more details on this in the regulation framework and strategy document that can be downloaded from the CWIS website. Next. We also have developed regulatory tools to assist with the implementation of this framework. So we have developed a guideline for inclusive urban sanitation service provision, which aims to promote safe and sustainable technology and service delivery. So it includes issues of cost effectiveness in terms of the technology that is chosen, issues of gender, disability, and so forth. So it allows service providers to know what the regulator deems acceptable in terms of the kind of technology that will be chosen for service delivery. Then we have developed also the sanitation services tariff setting. We have developed a guideline and model for that. So it's for determining sustainable and affordable tariffs for both sewage and non-sewage services. So if you want to know how do you set a tariff for emptying services, for example, this is where it is guided in this guideline. Next. We have also developed guidelines for citywide inclusive sanitation planning, which looks at holistically at the sector. These are not restricted to regulators. This is for any stakeholder that is wishing to implement CWIS in their respective city or country. So this guideline is able to guide on what community participation looks like, issues of business models, financial planning, gender issues are also included. Again, technology issues are looked at from a planning side. So it is an all-encompassing guideline that assists stakeholders to be able to know what aspects to put in place in order to implement CWIS. To further support the implementation of the framework, we have also, in collaboration with partners, developed what we're calling a service assessment planning tool, which aims to support regulators, utilities, and other authorities to achieve the 3 key CWIS outcomes, which are equity, safety, and sustainability. This is done by looking at the hardware choices that one would make for a particular city, the kind of revenue model that should be in place, whether the private sector is involved. The service delivery model also considers that. And having fed in these 3 aspects, then you are able to see what impact that would have in terms of the outcomes of equity, financial viability, and safety of the services. This is helping to target investments in the sector to ensure that there is value and that it is catering for all in our quest to achieve the SDGs. So next. This is the background to today's discussion. And I will invite 4 great regulators who have been in the process of implementing this framework, that you hear what we say from the horse's mouth in terms of what is now happening. How are the regulators actually putting this into practice? And how is this assisting to begin turning around sanitation service provision in the respective countries? So I will start with Chola. Chola Mbilima is from the National Water Supply and Sanitation Council in Zambia. She is the Senior Inspector, Financial and Commercial Management. She is an economist with over 15 years experience in regulation. And her focus has been primarily on issues of policy, governance, and economic regulation. So please, Chola, the floor is yours. Thank you. You can switch on your camera as well.
Thank you very much, Yvonne. And good afternoon, good morning to the panelists. That was a great presentation, Yvonne, and it really tackled on the issues that we as regulators are really grappling with in the space of citywide inclusive sanitation. So I just want to give a short presentation just to highlight how we have undertaken this journey as NOASCO. And I must mention that we are still in our formative stages. And so we are making those small steps, but I think that we are steadily progressing. Could I have the next slide, please? Okay, so my presentation, I'll basically just look a little bit on the policy and legislation, and I'll get into the institutional arrangement that we have come up with to support citywide inclusive sanitation. I'll highlight the progress that we've made so far, and also indicate a bit of what lessons we've learned through the process. Next. So in terms of the policy, in Zambia, we are governed by the water supply and sanitation policy. And this policy was recently developed. We had a policy that was existing before this one, but it was revised, and a specific policy to do with water supply and sanitation was then developed. And this was launched in 2020, the year 2020. And to support that policy, we have the Water Supply and Sanitation Act number 28 of 1997. And this provides for the regulator and also the service providers to provide both on-site and off-site sanitation. And it explicitly defines what on-site sanitation is, or rather what sanitation is in general. So it encompasses both on-site and off-site sanitation. So we have a very good legal basis to be able to undertake both service provision and regulation of on-site sanitation services. And this has been backed up also in the policy that I just mentioned. Next. So for us to be able to undertake, citywide inclusive sanitation, we had to look at what was the appropriate institutional arrangement that would support this. And we developed regulatory frameworks as NOASCO. And in those frameworks, we articulated an institutional framework that would support citywide inclusive sanitation. And that framework actually identifies primarily two key regulators. The Zambia Environmental Management Agency on one end, which focuses on protection of the environment and ecosystems, and then NOASCO, where I come from, is on the other end, and it is focusing on regulation of water supply and sanitation service delivery. Now, zeroing in on our role as NOASCO, we do regulate service providers, which we call commercial utility companies. We have 11 of those. So we issue them with licenses to provide water supply and sanitation services in specific areas. And these utilities then, as they begin to operate, they have leverage to actually engage private sector when it comes to issues to do with on-site sanitation and fecal sludge management. So what we've done as NOASCO is that we have given them that leverage and guided them in terms of how they can go about this. So we've issued what we are calling permitting conditions that they need to follow as they permit these private operators to engage with them in service delivery. And they can also extend this to the community as long as these follow through the regulatory requirements. So basically that is what we've laid out, and suffice to mention on this slide that what we have is that we have regulators on one end, and then we have service providers who can be the licensed utilities, private sector, or even community-based organizations. But I must mention that there is still a very strong role for local authorities in there, and I will elaborate how the local authorities come in, because they too have a role to play when it comes to enforcing certain aspects to do with on-site sanitation and fecal sludge management. Next. So just getting now to what we have done so far. So from the time that CWIS, guided the sector and the region in terms of issues to do with citywide inclusive sanitation, we as NOASCO, took it upon ourselves to begin to make steps in developing regulation and also trying to ensure that there was a service provision taking place in this space. So when we talk of service provision, I think we have been very clear that we are focusing on the entire service chain, from containment all the way to treatment, safe disposal, and also dwelling into aspects of reuse. So we categorized our implementation of this process into three broad categories. The first one was the institutional and legal review. So what we did was that we started to embark on the process of developing standards for on-site sanitation and fecal sludge management. And these we have done. We have a draft standard, which is just awaiting national-wide consultation, and then it will be passed into a standard which will govern how we operate in this area. And then we are also revising the trade effluent standard, which has been in existence for some time and it's outdated. So this process is ongoing. And then, as I mentioned before, we have developed a regulatory framework for on-site sanitation and fecal sludge management. And this was launched in 2018. And this is the one that articulates how we are going to go about providing the service and also regulating the service as we embark on the issues to do with citywide inclusive sanitation. The next pillar that we were focusing on was regulatory tools, to develop regulatory tools. So what we've done in that area is that we have amended the licenses for our service providers, the 11 service providers that I mentioned. So initially their licenses were saying water and sewerage companies. So now they are reading water and sanitation companies, because we want them to focus on both on-site and off-site sanitation service provision. So this was done in the year 2019. And then we developed permitting conditions for them to engage with the private sector, with the community organizations, or even with the local authorities in assisting them to provide this. And then we have also developed a couple of guidelines to do with tariff setting. We've revised our accounting guideline. We've also developed guidelines to do with service provision standards. And these, as we speak, we are actually disseminating these guidelines. Once the dissemination, which is taking place right now, is done, they will be enforceable, and will begin to compel the utilities to actually follow what is provided for in these guidelines. Then we have also adopted the guidelines that CWIS developed, the ones that have been mentioned by the first speaker. So these, we have adopted them and adapted them to our situation. And as we speak, again, we are undertaking consultations on these guidelines so that we actually start to implement them. In the area of zoning, we are guiding the utilities to zone their areas to ease the issue of service provision. And in 2020, we developed a framework for them, or a criteria that they can use for zoning. And then we've also helped the utilities by developing generic organizational structure and a list of skills that are required for them to be able to go citywide inclusive sanitation. And these were also launched in April 2021. Then on the regulation side, which is dealing primarily on the implementation itself, in 2020, we launched our strategic plan that runs for the period 2021 to 2025. And in there, we have a very strong focus on OSS and fecal sludge management. And we have articulated activities that we undertake to support the process of making citywide inclusive sanitation a key aspect of how we want to look at on-site sanitation and fecal sludge management. Then we have a roadmap that we have developed on how we want to progress. It is a very well elaborated roadmap, and this has got activities to do with service provision as well as regulation. It was developed in a systematic way so that we are able to approach this matter in a very orderly manner. Then to couple that, we are developing an information management system which is integrated for the sector. And here I must mention that without information, I think we have noted as a regulator that you cannot do both service provision and regulation. It becomes very difficult because you don't know where you are, you don't know where you are starting from. So it's difficult to note the improvements, it's difficult to plan interventions. So we have taken it as a priority to develop a system that will assist to manage information, and this will be integrated and it will be hosted by the ministry in charge of water supply and sanitation. We are also reviewing our own management information system as a regulator to ensure that data is collected and have KPIs that have been developed that focus on citywide inclusive sanitation. And then we have embarked on assisting 5 utilities to actually become citywide inclusive in terms of how they provide their services. And we are using the example of Lusaka City, which is also already rated as a CWIS city with the support from Bill and Melinda Gates. So these are now being used as experts to assist other utilities. And we are also embarking on a very vigorous program to do capacity development within the regulator and also in the utilities themselves. Next. So the lessons that we've learned basically are that, you know, when you are trying to embark on citywide inclusive sanitation, you need to have a different approach as a regulator. So as opposed to what we are used to as regulators, where we are either doing the command and control or incentive regulation, this actually requires a more innovative way of regulation. And what we've noted is that partnerships, issues of mentoring, capacity building, these will work much more better than our traditional ways of regulation. And that is what we are trying to explore as NWASCO. So we are embarking a lot on these partnerships, stakeholder engagements to be able to undertake this task. Then you need a very clear, elaboration of roles and responsibilities for various actors. So because this space has been left unattended to for some time, we have multiple players that have come on board to try and assist. And these now cannot just be pushed out. One needs to really articulate what would be the roles and responsibilities of the various actors, and then streamline those to ensure that there's order, in the OSS and FSM space. And that way, both service provision and regulation will be done much better. And then CWIS regulation also requires multiple stakeholder engagement. So you cannot do it alone. It's no longer a regulated affair, but we need to co-opt other players in order to be successful in this area. And the final lesson that we've learned is that data is a very important aspect. We cannot do without information and information management. So this is a must. We need to develop systems that will assist us to collect data, to process it, and to be able to use it for decision making that will influence citywide inclusive sanitation. So this is what I wanted to share, and I would like to thank you for listening and for your attention. Thank you so much.
Thank you so much, Chola. Thank you for that great presentation with very good detail. And since we're gender sensitive, ladies first, so it means the gentlemen must be much shorter in their delivery of the presentations. I'll invite Jacques. Jacques Ntonda is an engineer from Rwanda Utilities Regulatory Authority. He's the Director of Water and Sanitation. He's a civil engineer with more than 20 years extensive experience in the sector of water, sanitation, and environment. He's a specialist in public infrastructure development and management, as well as regulation of public utilities. Jacques, over to you.
Thank you, Yvonne. Thank you, everyone, for participating in this webinar. As I mentioned, she mentioned Jacques Ntonda. I will be presenting you the current status on how far we've gone with the regulation of on-site sanitation. And in a few minutes, I'm able to share what we did so far in Rwanda. Next, please. Yes, as maybe it can be in other countries, in Rwanda, sanitation is scattered in different laws, because currently we don't have a dedicated sanitation law. So we found some provisions in environmental law, water resource management law, and so forth. However, we have sanitation policy that is specifically focusing on sanitation together with the waste management and drainage and stormwater management. So as I was mentioning, responsibility is also shared within the policy itself and scattered in various institutions and areas. So households, local authorities, utility, water and sanitation utility, private operators, various ministries, and here we mainly combine sanitation together with the hand washing because we believe that even if you have a good sanitation, without hand washing, it won't be a complete sanitation per se. So the shared responsibility and scattered responsibilities has, of course, a big impact on planning and resource mobilization. because without having a dedicated responsibility for a given institution, it's mainly very difficult for investment and planning of operation maintenance costs. However, the policy says that the government has the responsibility to promote and provide directly or indirectly sludge emptying services and sewage system. That is well reflected in the sanitation policy and specifically on implementation strategy. So the status of service provision is that currently the service provision of sanitation services is within private sector from construction of septic tanks and other, other containments and capture through the emptying or the sludging of fecal sludge. So the private sector deals with the construction of capture and containments. We've got a big number of actors in the emptying or the sludging of wastewater of fecal sludge, as well as some initiative in resource recovery. However, the whole chain is not regulated. So we only regulate a portion, which is mainly emptying and transportation of fecal sludge. So in terms of a legal framework, the regulator has currently some tools to help in the regulation of fecal sludge management. And this consists of regulation on fecal sludge collection and transportation, as well as installation of decentralized wastewater treatment systems. However, that was the current, the past, and somehow the current. However, we've got a new approach. As Yvonne mentioned on the strategy for regulating on-site sanitation adopted by the Eastern Southern Africa Water and Sanitation Regulators Association, CWIS, we've also started some approaches for us to be able to regulate fecal sludge management. And we have developed guidelines for fecal sludge management. Next, please. Now, these guidelines were actually, what I can say, they're not new per se, but it was a collection of different documents from various provisions. And we made a single document that can be used that can serve as a tool for us to be able to start preparing some legal tools. So the guidelines, we ensure safe and sustainable service delivery across sanitation value chain, but also more specifically, they define stakeholders' role in fecal sludge management, activities to be licensed, the business models, as well as the minimum service levels. As I was mentioning, is that we did have some provision, but they were scattered in various documents. And the way these provisions were scattered in various documents, it was also the same for the role and responsibilities of various institutions. So the guidelines came to brought together the various provisions and put them in a single document that's going to enlighten what you're supposed to do in terms of activities, in terms of business models, and the minimum service levels. So the guidelines, the development was, it was extensive, of course, documentation of various documents. So we had various discussions with the stakeholders, the whole sanitation value chain. These were government agencies, ministries, NGOs, private sector, and all stakeholders within the sector. So we did a consultative meeting with the key stakeholders, and the final approval last year in December for the guidelines. Next, please. So we have adopted business models, two business models. One is that, as you can see, the sanitation value chain, from capture to reuse and disposal. The players are, of course, the utility for sewer sanitation, But for non-sewer sanitation or on-site sanitation, the utility is going to take over. And for the emptying transportation, can employ a private sector, or service providers can be private operators, as well as treatment and disposal. The second model is not that different. Next, please. Is not that different. The only difference is that the utility can take over the whole chain or engage a private sector for a given chain. So as you can see, they are not different, but for the first one, the utility can only decide to delegate the emptying transportation to private sector and then do the treatment and the reuse. So from this one, we next please, we brought the licensing framework, and the licensing we normally said next please. So the capture, of course, current capture and containment is to be licensed by local authorities, because they're the one that issues the construction permit. Then emptying transportation by the regulator, and we came to realize that we need 4 types of licenses for emptying and transportation, construction of fecal sludge treatment plants, operation and maintenance of fecal sludge treatment plant, as well as fecal sludge valorization. Those are 4 types of licenses that the regulator will be able to issue to private operators. Currently, we're only issuing emptying and transportation. Next. For this minimum service levels, of course, we're dealing with access, and we are considering that we need to include everyone in this process. And billing should be on monthly, and together with the water bills, the frequency of emptying should be planned based on the mapping of infrastructure, being pit latrine, septic tanks. But we want a scheduled emptying. Safe transportation, we don't prefer manual emptying. We don't accept manual emptying. We only we want to use motorized transportation system. Without taking much of our time, I'm available for the question, and thank you for your kind attention. Thank you.
Thank you very much, Jacques. Again, thank you for giving us an elaborate view of what's happening in Rwanda. I'll now invite experience from Tanzania, Engineer Exodi Fatayo Maro, who is the Director of Water and Sanitation at Energy and Water Utilities Regulatory Authority in Tanzania. He is a civil and water engineer with more than 25 years of professional experience in the water and sanitation sector, which includes 15 years working with Ewura itself. And under Ewura, his experience covers the broad sense of water sector reform and independent regulation of water and sanitation services. Over to you, Engineer Maro. Elizabeth, Ewura's presentation.
Yes, thank you, Yvonne. I'll start with an overview of the policy that we have been using in implementing the citywide inclusive sanitation. Awaiting cabinet approval, but this one is more for reliable, affordable, but also sustainable non-sewer sanitation services, so that we can effectively implement the citywide inclusive sanitation. We were also making use of the National Health Policy. This one is of 2017. And all the national environmental policy of back to 1997. That all these policies have been very useful, and also as a regulator, we've been taking lead in the reform. We have been able to identify the gaps and the need for the review of these policies, so that when times come, they are reviewed and take into consideration the aspect of linkages in the citywide inclusion. Hello?
You just froze, you're just back now. Do you maybe want to try turning your camera off to improve the quality of the connection?
Hello, can you hear me now?
Yeah, you've just come back now.
Oh, so should I? Hello, hello.
You can go ahead, Hotel.
Okay, thank you. Now we have 6 related national legislation for us to be able to integrate the citywide inclusive sanitation approach. And the first one is that one of what Water Resource Management Act, number 11 of 2009. And also the Local Government Act of back to 1982. So you can see the range of gap in the related national legislation. Also taking into consideration the policy gap between Hello?
We can get you. Please, you can continue. We seem to have
okay, thank you. Because the slide were not coming up. And now, after talking about the policy and the legislation, which included transport, water, and the sanitation. This sits at the President office. And we have the Ministry of Water, which is responsible for the quality and pollution control, but also water source protection, and as well as development of
Fateo? Could you try and switch off your video, Fateo?
responsible for the environmental protection and enforcement. And also we have the basin water boards, and these are responsible for the discharge permits and the water use permits and pollution. We have the Water Supply and Sanitation Authority. Previously, they were called Water Supply and Sewerage, but now they are Water Supply and Sanitation Authority. And these are the ones responsible for provision of water supply, but also sanitation services in all urban settings. At the regional level, report, including sanitation aspect in the annual performance review reports. And then you have the regulator, and this one is responsible for the water supply and sanitation services regulation. So these are the 8 institutions that we need to integrate as we go along capacity building. We have a number of consultative meetings that we have carried out, and these include capacity building to Water Supply and Sanitation Authority with regard to fecal sludge management, but also on-site sanitation. These were done last year, but also this year, this September, we are and we have issued new rules in 2020, which include the aspect of sanitation, specifically for non-sewered sanitation, meaning the on-site and how to deal with fecal sludge management. But also we have done water and wastewater quality monitoring guideline that we have issued to from EURA, and this one was carried out this particular year in August. We have been able to prepare a guideline on on-site sanitation and the fecal sludge management, which went hand in hand with a study that was carried out on on-site sanitation and fecal sludge management in 2020. Yeah, we are continuing with capacity building, as I've said, to the water supply and sanitation authority staff, working at the district level, township, but also at the regional level. And what we are looking forward now, hello? Hello?
We can hear you,
You are
Maro.
breaking sometimes, but you can go ahead.
Okay, sorry. I have an which have a lot of challenges in sanitation, especially on-site sanitation. And these are the city of Arusha, Dodoma, Mwanza, and Mbeya. And the other thing that we want to carry out is continue creating awareness of the tool, the city water includes capture very well information that are generated from the areas of operation of water supply and sanitation authorities with regard to on-site sanitation systems. And the other one is we are insisting to the water supply and sanitation authority to promote
Hello, Patel. Patel, are you able to get us? I think, colleagues, we've had quite a technical challenge with Patel's presentation, and we apologize for that, but it's a technical issue. So he keeps freezing and the Zoom is remaining behind, but he's actually finished his presentation. So we'll just proceed. Sorry for that, Patel. Thank you so much for your sharing. So we'll just proceed to Diodon, who will be sharing from Burundi, from the Water and Energy Regulator. He's a civil engineer with over 6 years of experience since the formation of ARIN. So over to you, Diodon, and hope we'll be more successful with the technical issues. Thank you. If you would have to do it in less than 5 minutes, Diodon.
Yes, Yvonne, thank you very much. Yes, my presentation is very short. I wanted to talk about the sanitation and regulation framework in practice in our country. As an introduction, I have to note that AREN began to regulate sanitation sector since 2018 with the support of SWIS. And I have also to mention that main mandate given to AREN to regulate the sanitation sector is from the decree which has been promulgated in November 2018. So in December 2018, a consultant visited Burundi to conduct and document findings of a baseline. And through consultation meetings done with that consultant, all stakeholders have been alerted about regulation of sanitation services, and they have been aware to know how to do well and more than before. So a regulation strategy and a framework for inclusive urban sanitation service provision, incorporating also sanitation services, has been adopted in our country and translated in French, exactly with the support of SOS through Bill and Melinda Gates project. Next. Okay, let's talk about the policy and the registration and also institutional arrangement used in the sanitation service chain. In Burundi, we have a national policy for sanitation and its operational strategy, Horizon 2025. And that policy is well organized because it covers all different aspects of sanitation sector. In that policy, it is clearly mentioned the definition of regulation is to ensure a balance between the interests of the various stakeholders in the sanitation sector, such as conflict resolution, scalable and realistic setting of tariffs, determination of penalties, and so on. Normally, I can say that the Burundi policy is well organized, as said above. But according to the law, we have now two laws which talk about sanitation. The first has been promulgated in March 2012, which is the law of water code, and another one is the law promulgated in May 2018, which is regarding of is talk about hygiene and sanitation. But I have to mention that all those two laws are not clear on some aspects to facilitate regulation and the provision of sanitation services. Through those laws, you cannot see where it is mentioned how to manage on-site sanitation services and so on. After analyzing all those challenges, AREN has proposed to review those laws. In terms of achievement, after proposing that review, the draft of water and sanitation law has been elaborated, and it has been discussed by the Council of Ministers yearly in March this year. And that law is under finalization. So the law will enable the sanitation sector to be improved in different aspects to comply with the best practices, because we have taken note with the recommended strategy during its elaboration. Let's now talk about implementation of sanitation regulation framework. And you can move to the next slide. Yes, thank you. The municipalities delegate now sanitation services provision to the private operators in order to deliver services. And we have a utility which is called the Obuha, which signs contracts with those operators for discharging to the treatment plant. We have that achievement has been made during this phase of implementation of that framework. Also, we have made the consultative meetings. One meeting has been organized on 5th August 2020 in order to see how the profession of imtiaz should be developed and supported. And we have also, Arena has also organized 5 workshops in 5 main towns in order to disseminate a regulation strategy and the framework. And that opportunity has allowed us to aware all stakeholders in order to understand how to improve the management of on-site sanitation services. Okay, I said I am talking about the utility. I have to mention that we have 2 utilities. The one is the Opuha, which is under the Ministry in charge of infrastructures. And there is also another utility called the Ahmed, which is based under the ministry in charge of hydraulics, energy and the mines. So Opuha have started to operationalize existing treatment plant constructed in different areas, such as in Bujumbura town or Gitega. And Opuha expects also to do the same in north part of Burundi, in the provinces of Ngozi, Muyinga, and Kayanza. So Ahmed, which is also involved in sanitation sector, has recently constructed 2. One has been constructed in Bubanza province, another one in Ruyigi province. And that Ahmed is also planned to build other fecal sludge treatment plants in the Lumonge province and the Kayanza. Also, another achievement made is that we have 2 universities, one of Gitega, another one of Ngozi, which are developing projects to reuse treated waste. We can move to the next slide. Okay, we have to note that now public and private operators are now more and more sensitized on the sanitation strategy and the framework. And this is likely to bring more effects in the near future. However, more needs to be fulfilled, because you have noted that the regulation of sanitation sector in our country dates since 2018. Also, we are making a collection of some data, and that collection is ongoing, awaiting that the study of sanitation status in our country should be conducted in order to have details on sanitation issues, especially on on-site sanitation services. I have to mention that we have a sewage system which cover around 4% of households in Bujumbura town, and another very small sewage system which is storage system located in Gitega. You understand that in our country, a lot of Burundian depends on on-site sanitation services. That's why we are trying to promote that aspect. So another achievement is that the municipality of Bujumbura has recently conducted a study in a collaboration with a private society, African Promotion of Sanitation, called the PROSAN, in order to build toilets, public toilets. the environmental toilets. So we have noted also that some communities have begun to construct autonomous wastewater treatment plants. The one treatment plant, autonomous treatment plant, is has been constructed at Buterere zone, and another autonomous treatment. Yes.
Thank you. Just 30 seconds, please. Thank you.
Thank you. Okay, I said that the second one is located in Gihosha zone. So the strategy framework for management of public toilets and the regulatory tools are required in order to implement well that regulation framework. Let's move to the next slides. The next slides is about some illustration of how is the situation. We have the first one. It is the main treatment plant for fecal sludge, which is located in Bujumbura town, and that the treatment plant receive the fecal sludge from sewage system, and the fecal sludge which are inputted from the septic tank. And now that the treatment plant is working well because of the effort made by Obuha after the dissemination of the regulation framework. Another picture shows how is the situation you can move to the next. How is the situation? And now you see that they are working on that. And you see that the vacuum truck, which has been recently purchased by Obuha in order to improve on sanitation services provision. You see now how the private operators are working in order to improve that aspect. That's why we have organized that workshop in order to aware all stakeholders in order to encourage the private operators. And the next slide is about the treatment fecal sludge treatment plant, which is constructed in Gitega. And the last one is the fecal sludge treatment plant, which has been recently, 3 months ago, constructed in Bubanza province in order to improve on-site sanitation in the west part of Burundi. I can conclude by saying that all of these achievements have been done because of the support from SOS. That we thank you very much, because before the elaboration and the adoption of the regulation framework, it was very difficult to sensibilize, to aware stakeholders without a document on which we should use in order to show the best practices which has been proposed or done by other partners. Thank you for your attention.
Thank you. Thank you very much. In the interest of time, I'll hand over to my colleague Kasenga, and we can have a discussion on the issues. Thank you. Kasenga, you're muted.
Thank you very much, Yvonne, my co-moderator, and a very warm welcome to everybody that is joining us today, and to all the presenters that have gone before, that have made their presentations already. Thank you for setting the scene. Now we are going to transition to a panel discussion to engage much more into detail on the aspects that have just been mentioned, but also to give an opportunity to the participants today to engage with the panelists as well as presenters. So to kickstart that, allow me to just introduce the four presenters, the four panelists that are going to be joining us today. I'll begin with Mr. Kitch Bauer, who is the Sanitation Project Manager at the African Ministers' Council on Water, where he has worked for 8 years now, and he has over 15 years experience in international development. Kitch, welcome. Next, allow me to introduce Dr. Baim Bengwere, who holds a PhD in environmental sciences and is currently Senior Sanitation Coordinator at the African Water Association. Dr. Mbaye has over 15 years experience in water and sanitation, and previously worked at Waterhead as Senior Urban Wash Manager. He has also extensively participated in structuring markets for fecal sludge management. Welcome, Dr. Mbaye.
Thank you,
All right. Next, allow me to introduce Mr. Kariyuki Mugo, who is Director WASH Sector Support for the urban poor, for the water and sanitation for the urban poor, that is WUSAP. He has over 14 years experience in the sector and has been heavily involved in projects and programs that aim obviously at uplifting the lives of the people that are living in the low income areas. Welcome, Mugo.
Thank you, Kasenga.
Thank you. And last but not the least, allow me to introduce Chola Mbilima, who has already been introduced. Is an economist and works at the National Water Supply and Sanitation Council in Zambia as Senior Inspector, Finance and Commercial Management. Chola has worked extensively in the reform processes in Zambia, but also assisting other countries in the region that are transforming to autonomous regulation that Zambia has embarked upon. She is also a specialist in economic regulation. Welcome, Chola.
Thank you, and good day, everyone, once again.
All right. So to the participants, there's a chat box right below the screen. Please, if you've got any questions or submissions to make, type it in there and we'll pick it up and float it to the panelists. But for starters, please allow me to begin with Kitch, who is from AMCAL. Mr. Bauer, we know that AMCAL recently launched the African Sanitation Policy Guidelines that aim to provide guidance to the African governments on how to develop clear and comprehensive policies as far as sanitation is concerned. And this is aimed to feed into the wider national programs that aim to change the sanitation outlook right across our continent. Now, the question to you is, what is the ASPG, in short, the African Sanitation Policy Guideline guidance when it comes to sanitation regulation?
Thank you, Kasenga, and good day to all the panelists and the participants. It's a pleasure to be part of this webinar. And like you said, yes, the ASPG was launched on June 10th, and it created just the kind of impact that we hope it would. And aside from, giving guidance on policy, sanitation policies, focusing, of course, across the different major components that will help our sector to facilitate effective service delivery. It is meant to just, kind of catalyze this kind of dialogue that we need to talk about on the different components of sanitation service delivery. And I'm very excited to be here to be talking about regulation, which I probably, it's interesting to hear from the experts who have been practicing this for a while. And so I will base my, to answer your question exactly, I think the ASPG covers broad different areas of sanitation service delivery ecosystem, but on regulation specifically, it gives some kind of guidance, and I will urge other participants and people who are not yet familiar with the ASPG to go through it to get this kind of guidance. But particularly, the ASPG, first of all, gives guidance on regulation, the need for regulation of the sanitation sector, say, and that regulation can be by an independent organization, as we've seen across the continent in some countries, or by contract. An example of an independent organization regulating sanitation, a typical example comes from Kenya, and of course, Zambia, where you're based, and WASCO, National Water Supply and Sanitation Council. For Kenya is the Water Services Regulatory Board, WASREP. And so we all know, I'm talking to the experts now, so I don't need to go into the details, but we know that by regulation by public authority, it's either a ministry, a local government, an agency is established by law to do the regulation, but also by contract, either a ministry, a local government with support from licenses and contracts enforced through legal means. In this case, assets are owned by a public sector asset holder, run by a private sector service provider under a contract between them. And that example of the kind of contracting of this kind of contract is evident in Senegal, where you have SONES and SDE. Secondly, the ASPG gives regulation, give guidance on the regulation of the entire sanitation value chain and service levels. By this, I mean from collection to transport to disposal to safe reuse and the rest of them. So, and also it gives regulation in terms of, whether you're at different levels of the sanitation ladder, and also in terms of whether it's a seaward or non-seaward sanitation. So this ASPG guides on how regulation requirements for each part of sanitation value chain. Now, the third aspect is also it gives guidance on how to optimize service provision through, for example, monitoring, and it encourages governments it gives guidance to governments to encourage improving service delivery by performance, service providers by performance through regulation. And this can be through the formation of key performance indicators for both non-seaward and seaward sanitation to guide regulation. It also, the ASPG also gives guidance on two additional areas, which one is the financial sustainability of service delivery, which of course
Keith, you are freezing on my side.
But I hope you can hear me. Hello, can you hear me?
Yes.
Now I can hear you. Sorry.
Okay, very good. So let me quickly round up since the internet is acting up. So the last two are the guidance on financial sustainability of services and guidance on participatory service provision ecosystem, so that there are the issues of accountability, transparency, consultation, and reporting in regulation are taken care of. And this is the kind of guidance that the ASPG gives, among other underlying issues that will ensure that the service delivery ecosystem is functioning, and service providers are getting value for money. Service users are getting the services they pay for. Over to you, Kasenga.
Thank you very much, Kate, for those responses and also elaborating generally what the ASPG contain. But again, I would like to zoom into the aspect of regulation. You did mention the various types that exist across the continent. You did mention regulation by contracts, the autonomous regulation, and so on and so forth. We heard also from the regulators in the Eastern and Southern Africa, well, actually implementing the autonomous regulation. But my question is, I'm sure when you were formulating the ASPG, you did some sort of analysis on how prepared the nations were with respect to implementing the recommendations in the guidelines. So how ready are the African governments to actualize regulation itself, maybe through policy provisions and so on?
Yes, thank you very much, Kasenga, for mentioning the assessment that we did. And that assessment covered 26 countries, which is about 47% of the 55 member states on the continent. Now, as far as regulation goes, we still have a long way to go. And I will give an example with ESAWAS to start with. You see, ESAWAS is Eastern and Southern Africa. And as far as my experience across the continent is concerned, I think most of the experience in terms of regulating sanitation is more in the eastern, southern, and of course, the northern part of the continent. West and Central Africa are still way, way behind. And even within the Eastern and Southern Africa, as has been mentioned by from the, I was taking note based on the presentation from Rwanda, the regulation in sanitation, as you can see in Rwanda, is only emptying and transportation and doesn't cover the entire other aspects of the value chain. So, but these are even the best practice examples, and we can look at Kenya, Zambia, of course, Tanzania, and some of the examples that come to mind within that sub-region. But if you look across the continent, there's still a long way to go. West Africa, I can give example of Ghana. Ghana has a regulatory agency that does not regulate sanitation. So, and it's common across the continent, which confirms the outcome of the assessment that we did, that whereas services like mobile telephone services, water supply, electricity, and others are regulated, sanitation is still lagging behind. And so a long time ago, we thought that it would be very nice and important for AMCAO to position itself to work closely with ESAWAS to ensure that we have regulation happening across the continent, because we believe it is very, very key to improving service delivery. Now, and thus, if we can start working on that, if we are able to do that, the ASPG is here to help us. We can now have, instead of ESAWAS, we can have an ASAWAS, AWAS, Africa, an Africa-wide network of regulatory agencies that can share best practices to improve on that and on how to discharge their mandate. So I think we have a long way to go, but opportunities like this help us to be able to, gather the evidences that we will use to advocate for improvement, and this will also help in the uptake of the ASPG. Thank you, Kasenga.
Thank you so much, Kits. Noted, and we hear you. We're working to looking at an African-wide approach. In the interest of time, I'll move on to Dr. Bai. And Dr. Bai, you coming from AFWA, the African Water Association, and from your experience, and also from what we've seen from ESAWAS, is that utilities for a very long time really are focused on sewer sanitation. So what are utilities doing to ensure that they now transition to this new mandate on non-sewer sanitation services?
Thank you, Kasenga, for inviting the African Water Association to attend this important webinar that shows tremendous progress in Eastern and Southern Africa as far as sanitation regulation is concerned. To answer to your question, I agree with you that African water and sanitation utilities focus, even so far, mainly on sewer sanitation. Unfortunately, in a context where most of the urban dwellers rely on on-site sanitation. And in some countries, these people, often the poorest one, pay taxes not linked to any services. For my view, this is a shame, and it even poses equity issues that need to be addressed. This is why water and sanitation service providers and utilities are starting to embed on-site sanitation into their mandate. In many countries, this has resulted in the recognition of on-site sanitation as a credible alternative to sewer sanitation. On-site sanitation is becoming not a stopgap solution, but a viable alternative for sewer sanitation. In some countries, we realize that within utilities, they create dedicated entities to on-site sanitation. We realize that in many, in the case of the Senegal National Sanitation Utility in Senegal, for instance, we realize also utilities introduce work on the interaction of innovation in order to facilitate the collection, transport, and treatment of fecal sludge. We also see the involvement of the private sector in the operation of on-site sanitation. We realize that in many countries, in some countries, the delegation, the operation of fecal sludge treatment plant are delegated to private sector. We realize, and also utilities are working, some utilities are working on introducing some kind of competition between private sector with the implementation of tools like the call center in Dakar, in Kampala, for instance. And also utilities work on training their staff in this new sector of intervention. However, to push this forward, I believe that the government should create an enabling environment, allowing water and sanitation utilities to be able to broaden their fields of intervention and to prioritize this type of sanitation. They, as you said, they used to work with sewer sanitation. This non-sewer sanitation is something new for many utilities. It is important that all the tools they need to broaden their area of intervention should be put in place in order to ensure that they can become effective in this new sanitation, on-site sanitation sector. Over to you.
Thank you very much, Dr. Mbaye, for that response. And you've mentioned something very, very interesting when you spoke about the private sector participation, and also that the utilities are trying to bring in mechanism to kind of incentivize or bring about competition of the private sector. But do you actually see a need for regulation in non-sewer sanitation from where you're standing as AFOA? What is your position and what's your advice on that? Regulators essentially bring to the floor the ability of the sector to overcome these monopolistic tendencies. So what's your take on that?
Yeah, very interesting question. Regulation, indeed, regulators have a very important role to play in the delivery of sanitation services, particularly in on-site sanitation. As I mentioned above, the establishment of an enabling environment is fundamental to encourage sanitation service providers to prioritize on-site sanitation, therefore the delivery of service to the greatest number of people. It is important that regulators help, among others, to first review the existing institutional organization for the introduction of reforms, if necessary, for delivering and operationalizing comprehensive policy and institutional and legal framework. It is also important for regulators to mobilize, to work on mobilizing the actors, the main actors around the need to give a place to non-sewer sanitation and to create a consensus between actors. This consensus is important, and when it is got, it is important to consider adjusting the license of the public water or sewerage supplier to become a truly water and sanitation company with responsibilities to manage sanitation service provision for all, mainly non-sewer sanitation. It is important also to initiate some kind, the development of quality of service standards, norms and bylaw to facilitate non-sewer sanitation services, including accessible and emptyable pit or septic tank, licensing of small private operators, introduction of innovation or innovative and technology approach, work on a suitable tariff setting, and so on and so forth. It is important also that regulators communicate with government for necessary subsidies for the benefit of poorest people. To this end, as AFOA, we believe that it is important to focus on three things. First, evidence-based advocacy in order to draw the attention of public authorities on the obstacles hindering the development of sanitation, so that they understand their responsibilities in the establishment of this enabling environment I early talked about. Secondly, capacity building for actors is very important. It is important to build the capacity of actors so that they have the same understanding of inclusive sanitation and the building block they must put together to achieve the goal of inclusive sanitation. What tools, for example, should be used to reach waters, for example, how to do it. These are things that only training allows us to understand. This is why AFWA in our CWIS program funded by the Gates Foundation, we are working on that, and more than 50 cities will be trained in this objective. Finally, we need to initiate some kind of benchmarking, exchange of experience through partnership. It is important. This partnership can allow utilities to learn each other. This is why AFWA in this project I mentioned earlier on is work on implementing various sanitation operator partnership that aim for enabling countries, cities, and service providers to learn from each other. And for me, the regulatory experience presented here should be shared in some kind of partnership, peer-to-peer partnership, so that the lesson learned can be used for better regulatory policies and other countries. Yeah, thank you, and over to you, Kasong.
Thank you very much, Dr. Bai, for those responses, and I'm sure everybody has taken note of those key messages that have come out. To all the participants, please, if you wish to interact with the panelists, type your question or contribution in the chat box below and we'll pick it up. Allow me to move to Mr. Karaoke Mugo from USAP. And USAP has been doing quite a lot of work on water sanitation, especially in the low-income areas. Now, we have seen that in the absence of regulation, the environment is characterized by high prices, perhaps poor safety of workers, compromised service quality, and so on and so forth. Do you think CWIS regulation has the potential to turn around this picture? Mogo.
Yeah, thank you, Kasenga. The answer is yes, because regulation is at the center of quality service provision, both national and subnational regulation, and I think it's been one of the biggest missing links in improving sanitation. Now, I think there are three things come into play, but let me say in general that the sector is waking up to the fact that investing in service provision without improving the policy, institutional, regulatory, business environment is actually filling a leaking bucket. And I think that's where all of us are. And we need to pay attention to all these elements of enabling environment. Now, if you look at regulation, I think number one, the sanitation sector is highly informal. And I think regulators are very key to formalizing markets, whether it's determining pricing, whether it's dictating, not dictating, but setting the standards for the quality of service, or even ensuring that the services are sustainable. So formalization of market is one of the things that needs to be done. I know there are other issues that have been mentioned before about mandates, clarity of mandates, and the like. But I think specifically regulators play a critical role in ensuring that markets are formal. And that's one of the things we need to do in sanitation subsector. I've mentioned standards, and these standards are very different. It could be standard operating procedures for pit emptying, could be health and safety of workers. It could be quality of capture facilities at household level, or transportation equipment, or whatever it is. I think in terms of setting standards, regulators are very key. And the other thing I like to mention is about ensuring equity. We all know that service providers, and I'm not allocating blame here, they like to do what is easy and what is traditional. I know there are many facts behind that, but naturally, that's what service providers prefer to do. So holding service providers accountable, whether they're private or they're public or whatever nature of service provision arrangements are in any market, is very critical. Ensuring that their KPIs, they're held accountable to make sure that those who are served and those who lack any other form of access are served. I think that is very important. And finally, I think we cannot underrate the position of regulators in the sector in terms of a voice. Not necessarily in terms of what regulators do on day-to-day basis or what they are mandated by law, but also providing clarity on a number of issues and participating and bringing, what can I say, experiences that enrich discussions around financing, around planning, or around service provision, whatever it is. I think regulators are very core. So I'm happy that the sector is also, there's a lot of conversations and regulators are getting interested in sanitation service provision. And I think regulators have not done that before. They've always been looking at sewerage. So I think we are moving in the right direction. I can see Chola enthusiastic.
Thank you so much, Mugo. We're running out of time, but I'll come back to you over the question of accountability and the voice that you touched on. But let me go to Chola. And Chola, Zambia has been implementing CWIS regulation for some time now, as you had mentioned in your presentation. But what are the two key factors you would advise any other player wishing to embark upon this journey to replicate in order to ensure there's success along the journey?
Thank you for that question, Kasenga. I'll be straight to the point. The two critical issues that need to be in place are one, policy and legal frameworks, because if you don't have that, then what Dr. Mbaye was talking about, the enabling environment, will not be there. And so regulators will not have the space to develop regulations, to develop standards, to develop frameworks in which to operate. And so that is just a non-starter. Number two, data collection and information management mechanisms. Like I mentioned in my presentation, if you don't have data, then you don't know what you want to do. So data collection, information management systems are very critical. We need to put those in place. We need to establish baselines so that we know what we are talking about. What is this on-site sanitation that we are talking about? Where are we? Where do we want to progress to? And what are the challenges therein? So those are the two critical issues, Kasenga. Over to you.
Thank you very much, Chola, for those responses. Mugo, let me come back to you on the question of the voice and accountability. And as also you already introduced that you're also working quite extensively low-income areas. But what can be done to ensure that proper focus is not lost and that consumer participation is strengthened in regulation, in particular regarding non-sewered sanitation?
Yeah, thanks. I think the question of accountability again goes back to clarity of mandate. I think that's where it all begins. And I think that is where everything has fallen apart, because when you don't have clarity of mandates, then no institution is responsible for a service. So I think at times we always think about accountability from the service provision level, consumers versus service providers. And at times we tend to blame service providers for weak enabling environment. And a weak enabling environment means lack of accountability. So I think when you don't even have laws that or a constitution that tells people that this is your right, you can go to court, you can impeach a president or something like that. then everything is left at the mercy of whoever feels interested to support. So I think the issue of accountability, according to me, begins from the top. It doesn't begin from the bottom. Now, coming back to the role of regulators, I think where we have regulations and where we have regulators who are have clear authority, I think they have responsibility, and this is the time we start thinking about the standards or the KPIs, the performance indicators for service providers. We need to look at that. But related to what Mbaya was saying, I think accountability is not just about mandated service providers. We need to see what other players can do so that they're also able to contribute to service provision, and particularly at the small and medium enterprises. So when you have a certain segment of service providers not captured, so they can't take any responsibility, they operate under informality because you don't have proper licensing or proper contracting mechanisms for public sector delegation to private sector, informality thrives, and that also becomes very difficult to drive accountability. So I think if we sort out the top in terms of clarity of mandates and improving policy, institutional, regulatory, business environment, then very directly we are tackling issues of accountability, and we know who's supposed to do what at every level. And we have policy and legal framework to hold people accountable.
Thank you very much, Mugo. And indeed, regulation is intended to bring about accountability of the various players, but also should have a space for consumer participation. I haven't seen any question from the audience today. It's been very quiet, and we're running out of time. We had initially earmarked to end at 16:30. Yvonne, unless there's any question that I could have missed, have you come to any question from the audience?
No, apart from the one that you already received from Ikiti State, but I think that has been tackled within the general discussions. So
all right,
we can wind up.
Okay, so thank you very much, dear panelists and all the presenters, and also the audience, all the participants, much as you were quiet. Today, we intended to demonstrate the practicalities from regulation of CWIS, what the various regulators are doing and what the various stakeholders have been doing. You heard about the African Sanitation Policy Guideline, intended to provide guidance to the African governments, but also ensure that the policies that are developed clearly clarify the roles that the various players do play in sanitation. As you heard from the presentations, it's quite a number of actors, environmental regulators, the water sanitation regulators, but there's also a role for civil society and indeed the consumers themselves. We're told that over 2 billion people on the planet rely on on-site sanitation service, and it's become urgent that regulation needs to move into that space. More importantly, that there are frameworks for service provision as well. So you've seen the journey that ESAWAS has embarked upon, and also the examples that have been given from countries like Zambia, Tanzania, Rwanda, and Burundi. Commendably, Rwanda is already in the process of implementation, and also Burundi did demonstrate what they're doing on the physical infrastructure as well, but a very large extent have engaged the stakeholders and to clarify their roles, much as the policy, as we heard, is very, very explicit and clear about that. We heard from the Rwandan case the sort of models that are play in terms of service provision, where the utility undertakes the various roles across the sanitation value chain, but there's another model where the private sector participation is encouraged, either in the emptying or transportation or the treatment processes as well. But what has come out across the various presentations on the panel discussion, there's a lot of emphasis on data so that we make informed decisions. And as you heard, regulators are in the process of remodernizing their data collection tools. They put in place guidelines that could be used by themselves as regulators, the service providers they regulate, and any other player who's operating in this space. There was a lot of emphasis from Dr. Mbaya as well on capacity building, and that this is a continuous process, and the fact that this is a fairly new mandate for most of the utilities. Continuous capacity building has to be undertaken, and the regulators themselves did demonstrate this to some extent. Advocates along the whole process is also something that has been emphasized, and the fact that data has to be collected to inform decisions. There is a complementary role that is played by benchmarking. Benchmarking essentially among the utilities across the countries, across the region, to ensure that we aspire each other to greatness. Some of the other key points that I did pick were issues of refinement in terms of implementation of the regulatory frameworks. The regulators did demonstrate that the regulatory arrangements that are recommended by ECOWAS have been adopted and are being adapted to their local settings, including some of the guidelines that ECOWAS has formulated. But we also had, in some cases, there's need for legal reviews to conform to the recommendations. So these are some of the key messages that I picked from these discussions. I can emphasize once more that it's been emphasized today that regulation plays a key role in ensuring that there's accountability, particularly among the service providers. So the regulator is there to mediate between the governments who are implementing all these public health policies and also the service providers who are called in to participate and ensure that we adequately service the people we are called to serve. I'm sure there are other points that the audience did pick up as learning points. These are some of the key messages that I could summarize from the discussion. And this particular event has been recorded in case you want to listen to it further. So thank you very much once again, everybody. Thank you, the presenters, for your eloquence and sharing information and knowledge. I know SOAS has planned a series of webinars, so welcome again our audiences to our next series. Please be on the lookout on our website, www.soas.org, for more information. And to our partners, AMCAO, AFWA, and USAP, thank you for making this webinar possible and for co-facilitating it. Yvonne, I now hand over to you for the closing formalities. Blessed day.
Thank you so much. I think you've basically closed. Thank you again to all the attendees, as well as our speakers and panelists. So you can always download the regulating sanitation, the sanitation regulation framework and strategy from the SOAS website. Publications under sanitation, you'll see we have quite a lot of resources, including the guidelines that we've developed. And always feel free to please communicate with us, and we'll be able to continue engaging with you. So thank you very much and good day.